Microbiology for GNM Unit 3, Infection and its Transmission, Sources and Types of Infection. Infection is the entry and multiplication of harmful microorganisms like bacteria, viruses, fungi or parasites inside the body, which may cause disease. Sources of infection. Sources of infection are the places, individuals, animals or objects from where infectious microorganisms originate and spread to other individuals, causing disease. These sources can be living, like humans or animals, or non-living, like air, water, food, soil, or contaminated objects. Exogenous source microorganisms enter the body from external sources such as air, water, food, or objects. Airborne source spread through air by tiny droplets from coughing, sneezing, or talking. Example: measles, tuberculosis, TB. Waterborne source spread by drinking or using contaminated water. Example: cholera, hepatitis, AA. Foodborne source caused by eating contaminated or undercooked food. Example: typhoid, food poisoning. Contact source transmitted through direct physical contact, person to person, or indirect contact, objects, surfaces. Example: scabies, ringworm. Human sources, infected individuals showing symptoms. Carriers harbour the pathogen but show no symptoms. Healthcare workers with poor hand hygiene. Animal sources, zoonotic. Animals carrying diseases like rabies, plague, anthrax. Infected birds, e.g. avian flu. Insects like mosquitoes, malaria, dengue, and ticks, Lyme disease. Vector-borne source transmitted by insects like mosquitoes, ticks, or fleas. Example: malaria, dengue, fomites, contaminated objects, non-living objects such as towels, bedding, utensils, or surgical tools. Example: MRSA, transmission through surgical instruments. Endogenous source microorganisms that are already present in the body but become harmful when immunity is low or barriers are broken. Example: E. coli, normal gut bacteria, causing urinary tract infection. Types of infection based on spread. Local infection stays limited to a specific part of the body. Example: boil or infected wound. Systemic infection spreads through the bloodstream and affects the whole body. Example: septicemia, blood poisoning. Based on duration, acute infection develops suddenly and lasts for a short time. Example: common cold, flu. Chronic infection develops slowly and lasts for a long period. Example: tuberculosis. Latent infection remains inactive for some time and becomes active under certain conditions. Example: herpes virus, nosocomial, hospital-acquired infections that occur after a patient is admitted to a hospital, usually after 48 hours. These are often due to poor hygiene or invasive procedures. Example: UTI from a catheter, surgical site infections. Opportunistic infection. These occur in people with weak immunity, where even normally harmless microbes can cause serious illness. Example: fungal infections in HIV patients. Community-acquired infection. Occurs outside hospital settings. Examples: COVID-19, dengue, typhoid. Spread in homes, schools, or public places. Primary infection. First infection caused by a pathogen in a healthy person. Example: primary tuberculosis infection. Secondary infection. Occurs when another infection develops during or after the treatment of a primary infection. Example: fungal infection after antibiotic treatment. Nosocomial infections. Nosocomial infections are infections that a patient acquires while receiving treatment in a hospital or healthcare facility, which were not present or incubating at the time of admission. These are also known as hospital-acquired infections, AHAs. develop after 48 hours of hospital admission, may also appear after discharge if linked to the hospital stay. Common in ICU, surgical wards, or during use of catheters, ventilators, etc. Common types of nosocomial infections: urinary tract infections, UTIs, often due to catheter use surgical site infections, SSIs, infections after an operation bloodstream infections, BSIs, due to IV lines, injections, pneumonia, especially in ventilated patients, VAP gastrointestinal infections, e.g. Clostridium difficile common microorganisms. Involved Staphylococcus aureus, including RSA, Pseudomonas aeruginosa, E. coli, Klebsiella, Clostridium difficile, prevention of nosocomial infections, proper hand hygiene, use of personal protective equipment, PPE, sterilization of instruments, safe handling of catheters and IV lines, maintaining clean environment and surfaces, educating healthcare staff and patients. Factors affecting microbial growth. The growth of microorganisms is influenced by physical or environmental factors and chemical or nutritional factors. These factors determine their survival, reproduction, and metabolic activity. Physical or environmental factors. These factors include conditions that directly affect microbial growth and metabolism. Temperature, moisture, water availability, pH, acidity or alkalinity, oxygen availability, temperature. Temperature plays a vital role in microbial growth, as different microorganisms thrive at specific temperature ranges. Psychrophiles, cold-loving microbes, grow between -5 degrees Celsius to 20 degrees Celsius, e.g. Pseudomonas species. Mesophiles, moderate temperature microbes, grow between 20 degrees Celsius to 45 degrees Celsius, including many human pathogens, e.g. Escherichia coli. Thermophiles, heat-loving microbes, grow between 45 degrees Celsius to 80 degrees Celsius, e.g. Bacillus staurothemophilus. High temperatures can denature microbial proteins, while low temperatures slow down metabolic activity, preventing growth. Moisture, water availability. Water is essential for microbial metabolism and growth. Microbes require water for enzyme activity, nutrient transport, and cell division. Desiccation, drying, inhibits microbial growth, but some bacteria form endospores, e.g. Clostridium botulinum, which allow them to survive in dry conditions. Osmotic pressure influences microbial survival. Halophiles, e.g. Halobacterium, thrive in high-salt environments. Osmotolerant microbes can survive in low water conditions. pH, acidity or alkalinity. Microorganisms have an optimal pH range for growth. Example, acidophiles thrive in acidic conditions, e.g. Lactobacillus acidophilus in yogurt, Thiobacillus ferrooxidans in acid mine drainage. Neutrophiles grow best at neutral pH, e.g. Staphylococcus aureus. Alkaliphiles survive in alkaline environments, e.g. Vibrio cholerae, Bacillus alkalophilus in soda lakes. Oxygen availability. Different microbes have varying oxygen requirements. Example, obligate aerobes require oxygen, e.g. Mycobacterium tuberculosis. Obligate anaerobes cannot tolerate oxygen, e.g. Clostridium botulinum. Facultative anaerobes grow with or without oxygen, e.g. E. coli. Microaerophiles require low oxygen levels, e.g. Helicobacter pylori in the stomach. Chemical, nutritional factors. Microorganisms require specific nutrients like carbohydrates, proteins, and minerals for survival and energy production. Blood and body fluids as nutrient sources. Microorganisms can use blood and body fluids as nutrient sources, which directly influence their growth. Blood supports pathogens needing iron, Staphylococcus aureus, plasma serum, rich in proteins and electrolytes. CSF, site for bacterial infections like meningitis, Streptococcus pneumoniae, saliva, mucus, contain enzymes, lysozyme, that inhibit microbes. Urine, normally sterile but can support growth in UTIs, E. coli. Cycle of transmission of infection. The cycle of infection explains how infectious diseases spread from one host to another. Breaking any link in this cycle helps prevent infection. Infectious agent microorganisms that cause disease, bacteria, viruses, fungi, parasites, reservoir, source of infection. The place where the microorganism lives and multiplies. Human body, animals, soil, water, food, inanimate objects. Portal of exit, the path by which the organism leaves the reservoir. Examples: respiratory tract, e.g. coughing, sneezing; gastrointestinal tract, e.g. vomiting, feces; urinary tract, e.g. urine; skin, e.g. wounds, cuts; blood, e.g. needle sticks, menstruation; mode of transmission, how the organism travels from one person to another; direct transmission, physical contact, e.g. touching, kissing, sexual contact; indirect transmission through contaminated objects, fomites, water, food, or air; droplet transmission, large droplets from sneezing, coughing, e.g. flu, COVID-19; airborne transmission, tiny particles that stay suspended in air, e.g. TB, measles; vector-borne transmission, insects like mosquitoes, ticks, or fleas, e.g. malaria, dengue; portal of entry, the path through which the organism enters a new host. Examples: respiratory tract, inhalation; GI tract, ingestion; genital tract, sexual contact; skin, cuts, wounds, injections; mucous membranes, eyes, nose, mouth, susceptible host, a person with low immunity who can get infected easily. Examples: elderly, infants, surgical patients, immunocompromised. I really prefer mango pickle, sister. I, infectious agent. R, reservoir. P, portal of exit. M, mode of transmission. P, portal of entry. S, susceptible host. Reaction of the body to infections. Definition: when pathogens, bacteria, viruses, fungi or parasites invade the body, the immune system responds to eliminate the infection and protect the body from harm. Stages of infection and body's response. Incubation. Period time between infection and appearance of symptoms. Prodromal stage. Early mild symptoms. Fever, fatigue. Acute stage. Full symptoms appear and the immune system fights back. Decline. Stage. The immune system gains control and symptoms reduce. Convalescence. Recovery phase. Body regains strength. Signs of infection in the body: local reactions, redness, swelling, heat, pain due to inflammation; systemic reactions, fever, chills, fatigue, nausea, headache; immune response activation, white blood cells, WBCS, increase. Mechanism of resistance. Resistance is the body's ability to prevent or fight infections through immune responses and protective barriers. Types of resistance: innate, natural immunity, present from birth, first line of defense; acquired, adaptive immunity, developed after infection or vaccination; innate, natural immunity, first line of defense, physical and chemical barriers; skin, prevents microbial entry; mucous membranes, trap microbes; stomach acid, kills pathogens; tears and saliva contain lysozyme, kills bacteria; Second line of defense, inflammatory response and phagocytosis. Inflammation, swelling, redness, pain to contain infection. Phagocytes, WBCs, destroy microbes and e.g. neutrophils, macrophages. Fever raises body temperature to kill pathogens. Acquired adaptive immunity, third line of defense. Specific immunity targets specific pathogens. Involves humoral immunity, B cells and antibodies. B cells produce antibodies against pathogens. Cell-mediated immunity, T cells. T cells kill infected cells. Memory cells provide long-term immunity after infection or vaccination. Factors affecting resistance to infections. Age. Infants and elderly have weaker immunity. Nutrition. Poor diet lowers resistance. Hygiene. Poor sanitation increases infection risk. Vaccination provides immunity against diseases. Stress and sleep affects immune function. Antibiotic resistance. Superbugs. Overuse, misuse of antibiotics leads to drug-resistant bacteria, e.g. MRSA, TB. Prevent resistance by completing prescribed antibiotic courses and avoiding self-medication. Conclusion: the immune system fights infections using barriers, WBCs, and antibodies. Natural and acquired immunity help prevent reinfection. Good hygiene, nutrition, and vaccinations enhance resistance. Preventing antibiotic resistance is essential for public health. Collection of specimens. Specimen collection refers to the process of obtaining biological samples from a patient for laboratory examination, diagnosis, and treatment monitoring. Proper collection ensures accurate test results. General guidelines for specimen collection. Use sterile containers and equipment. Follow universal precautions. Hand hygiene, gloves, PPE. Label specimens with patient name, date, time and test requested. Transport samples immediately to the laboratory under proper conditions. Prevent contamination by avoiding contact with non-sterile surfaces. Types of specimens and collection methods. Blood specimen collection. Purpose: diagnosis of infections, blood disorders, metabolic conditions. Methods: venipuncture, blood drawn from a vein, most common. Capillary blood collection, used for infants or glucose testing, finger prick, heel prick. Arterial blood collection, for blood gas analysis. Precautions: use sterile syringes/vacutainers. Avoid prolonged tourniquet use, may alter results. Invert tubes gently if anticoagulants are present. Urine specimen collection. Purpose: diagnosis of kidney diseases, infections, metabolic disorders. Types of urine samples. Random urine sample, collected anytime for routine analysis. Midstream, clean catch urine, preferred for culture and sensitivity tests. 24-hour urine collection, used for kidney function and metabolic studies. Catheterized urine sample, for patients unable to urinate naturally. Precautions: use a sterile container for culture tests. Discard the first urine in 24-hour collection and collect the rest. Refrigerate the sample if delayed in transport. Stool specimen collection. Purpose: diagnosis of parasitic, bacterial or viral infections, digestive disorders. Procedure: collect in a clean, dry container. Avoid urine contamination. Use preservatives if needed for parasite examination. Transport immediately for microbiological testing. Precautions: avoid contamination with water or disinfectants. Provide patient instructions for self-collection. Sputum specimen collection. Purpose: diagnosis of respiratory infections, e.g. TB, pneumonia. Procedure: best collected early morning before food or drink. Ask the patient to cough deeply into a sterile container. Transport immediately to the lab. Precautions: ensure sputum, not saliva, is collected. Rinse mouth with water before collection. Cerebrospinal fluid, CSF, collection. Purpose: diagnosis of meningitis, encephalitis, and neurological infections. Procedure: collected via lumbar puncture by a trained professional. Aseptic technique is essential. Send immediately for analysis. Precautions: maintain sterility throughout the procedure. Monitor the patient for post-procedure complications, e.g. headache. Wound swab/pus specimen collection. Purpose: identification of bacterial infections in wounds or abscesses. Procedure: use a sterile cotton swab to collect from deep inside the wound. Avoid contamination with surrounding skin. Transport in transport media if delayed. Semen specimen collection. Purpose: fertility analysis, sperm count, motility assessment. Procedure: patient collects by masturbation in a sterile container. Sample should be kept at body temperature and transported within 30 minutes. Precautions: avoid contamination. Ensure abstinence for 2 to 7 days before collection. Transport and storage of specimens. Maintain proper temperature, e.g. blood for culture at room temperature, urine in a refrigerator if delayed. Use transport media for microbiological samples. Label and document details accurately. Conclusion: proper specimen collection, handling and transportation are essential for accurate laboratory results and patient diagnosis. Following correct procedures prevents contamination, ensures sample integrity, and improves diagnostic efficiency.